Hey there, this is Dr. Mike from Foothills Chiropractic. Jumping on a quick live this morning. Just going to go wait a couple seconds to get started. Pull up the office page real quick. All right, so we're going to get started. Started delving into doing some more educational stuff for our patients. We'll be emailing these videos as well. And I want to talk about probably the one thing that separates chiropractic from just about every other healthcare profession. And that's this idea or this concept called salutogenesis. And what salutogenesis talks about is doing things to improve your health. So healthcare practitioners that have as their sole purpose for being the improvement of your health. Now, we can contrast salutogenesis with another concept, with this pathogenesis. Pathogenesis is anything that relates to disease or symptoms or sickness. So the vast majority of healthcare practitioners in the world are pathogenic in nature. That means that all they worry about is symptom. You have symptom A, they're going to do treatment A with the hope of resolving those symptoms. There's no other end result for them other than the symptom going away. Whether you get healthy or not, whether your health improves, is not necessarily, I don't want to say it's not the aim of those healthcare practitioners, because everyone wants to see people get healthier. But really, if you go in there with stomach pain, regardless of your health, regardless of what happens, their only goal is to make your stomach pain stop. And I'm not saying it's a bad thing. I'm just saying it's not what we do in chiropractic. It's just different. If you have a severed limb, you need to go to a pathogenic doctor and get those symptoms relieved, because that's going to ultimately affect your health. So that's pathogenesis. We can't really talk about salutogenesis till we talk about pathogenesis. So we did. Now, salutogenesis, this term was coined back in the 70s by, I forget the guy's name. I think he was a Russian medical doctor. Antonovsky, I believe his name was. But it's anything that you do that can help promote your health. So if you go to a doctor, such as a chiropractor, and our only goal is to improve your health, that's called salutogenesis. And that's what separates us. Is my goal every time you come into the office is that you walk out healthier and more balanced than when you walk in. That's my only objective. And granted, we see tremendous results with people symptomatically when we do that. But symptomatic relief is not necessarily our number one objective, because there's nothing I can do to make your symptoms go away other than take a pathogenic approach and give you drugs or give you injections. But when I do what I do, when we balance the nervous system, we balance the body, it's able to heal. And that very often leads to less symptoms. Almost as a side effect. You know how drugs have a side effect? You know, you watch the commercials and, they tell you about the drug and then spend 2 minutes telling you about all the adverse side effects that can happen. So when you get adjusted, a lot of things can happen. And one of the side effects is your symptoms go away. Kind of cool. Most side effects are bad. These side effects are good. So to wrap up, it's really simple. Salutogenesis is any healthcare practitioner that has as their sole aim and their sole objective the improvement of one's health. And that's what you get at Foothills Chiropractic. You get balanced, you get healthier, and very often your symptoms go away. Not all the times, but pretty much all the time symptoms go away. So that's salutogenesis. That's a very, very important concept, a very important topic to get. And the other thing about salutogenesis, is this: the longer you go, the more your health improves. So if you picture like this whole screen, let me get my finger right. There it is. So if this whole screen is your timeline of your life, from birth to death, the longer that you stay under salutogenic care, the more your health is going to benefit. There's no end to your ability to continue to get healthier. So that's salutogenesis. It's good stuff. It's why I am in practice. It's why I do what I do. It's why I love what I do every day. I get to come to the office and help people get healthier. And a lot of them feel better too. So it's all good. I want to thank you for watching. We will see you in the office hopefully this week. Have an awesome day. Peace.